Hi Ruslan, my name is K2 and I'm going to be doing a head-to-toe assessment this evening. Do you have any questions before I begin?
No.
Okay. Alright. So, like I said, my name is K2. I'm a registered nurse. And so for this assessment, I'm gonna have you sit up, and in some cases, I'm also gonna have you lay down
Okay.
for abdomen assessment. Okay. Let's go ahead and start inspecting with your head. Okay. Okay. All right. So now I'm gonna go ahead and start inspecting and palpating your skull and your head. So first, I'm just gonna inspect. Okay. Your face is symmetrical. I don't see any abnormalities. So let me go ahead and start off with palpating of your scalp, okay?
Mm-hmm.
Okay. No lesions or no masses noted. That's good. It's smooth and even on both sides. Your hair are brown with some grays, and your facial expression is appropriate for the examination, and your face is symmetrical. Now I'm just going to go ahead and palpate your temporal arteries, okay?
Mm-hmm.
Okay. There are both sides are even and regular pulses. Now I'm just going to go ahead and palpate your TMJ. So if you could just open your mouth for me, please. Close it. Okay, one more time. Okay, close it. Okay. It's both symmetric on both sides. I don't see any abnormalities such as clicking. Now I'm just going to go ahead and fill your sinuses. So I'm going to start with the maxillary sinus, which is right here, and tell me if you feel any pain or tenderness, okay?
No.
No? Okay. Now I'm going to go ahead and palpate your frontal sinuses, which are right here, and let me know if you feel any pain or tenderness.
No.
Good. Okay. In case if you do feel tenderness, I would pass a light through your sinuses to see, to examine further. Okay, now I'm going to proceed to mouth and throat.
Mm-hmm.
Okay. So now I'm going to go ahead and proceed with your mouth and throat. So for this one, I'm just going to shine a light in your mouth to see better, okay?
Okay.
And if you could just open your mouth, please, for me. Okay. And stick your tongue out, please. And can you say out, please? Good. Your mouth is pink and moist, which is normal. When you say ah, your uvula moved and it's midline. Your teeth are clean and white, and they're symmetric on both sides. For this examination, I'm not gonna do a gag reflex. And your tongue moved easily and freely. Are you having any pain or any kind of abnormal sensation in your mouth? No? Okay, thank you. So now I'm going to go ahead and do assessment on your neck, okay? So if you could just look up a little bit. Okay. So I'm just going to take a look at your neck, inspect your neck. Okay, your neck is midline, no abnormalities noted. No lumps noted. I don't see any pulsations either. Now I'm just going to go ahead and inspect your cervical lymph nodes, okay?
Mm-hmm.
Okay. I don't feel any lymph nodes, so that's good. Now I'm going to go ahead and inspect your trachea, and then I'm going to go ahead and palpate your trachea, okay? Right here. Okay. So your trachea is midline, and so that's good. And then now I'm going to go ahead and test your range of motion of your neck, okay?
Okay.
So if you could just turn to the left, please. Okay, come back and turn to the right, please. Okay, you can come back. Can you look up? Okay. Can you look down, please? Good. Okay. So can you look on the left side, please? Okay. And push against my hand. Good. And do the same thing on the other side. Good. Okay. So you have no problems with the range of motion. You were able to move without difficulties. Are you feeling any pain or anything when you
No.
turn your head? Okay, that's good. Okay, now I'm just gonna quickly listen to your carotid pulse to see if I hear any brooding or anything. Okay. I don't hear Broovy. Broovy is abnormal swishing sound, and I don't hear that, so that's normal. Okay, so now I'm going to go ahead and move on to the heart, okay?
Okay.
Okay. So now I'm just going to inspect your heart. Inspect. Okay. Okay. I don't see any pulsations, abnormal pulsations, or heaves on your chest or on your in your heart area. So I'm just going to go ahead and palpate your heart area. Okay. I don't feel any impulses of thrill. So now I'm going to go ahead and listen to your hearts in 4 different areas. And I'm going to listen to it with the diaphragm and with the bowel, okay? Right now I'm listening to the aortic area. Now listen to the pulmonic area. I'm going to move on to the ribs point. Now I'm going to listen to the tricuspid area. And I'm going to listen to the apical area, which is the mitral valve. Okay. Your heart sounds are normal, S1, S2, regular lift up, no abnormalities noted. So now I'm going to listen to the all 4 areas with the bell, okay? Okay, Russ, now I'm going to go ahead and do assessment on your abdomen. So first I'm just going to inspect your abdomen and see if it's flat or rounded. It looks like your abdomen is flat, and I don't see any abnormal pulsations in your abdomen. And your it looks like it's symmetric on both sides, and your belly button is midline. Okay. Now I'm going to go ahead and listen to your belly, and usually we listen to your belly for 5 minutes in each of the 4 quadrants, but for this video I'm just going to listen to it real quick and see if you have any bowel sounds, okay? Okay, you do have bowel sounds in all 4 quadrants and they're active, so that's normal. Now I'm going to go ahead and percuss your abdomen in all 4 quadrants. What I'm going to do is I'm going to tap on your abdomen and listen for the sounds, okay? Different sounds. Okay. So I listened for tympani on 3 of the quadrants, and the right upper quadrant you had a little bit of dullness, which is normal because of the liver being there. And now I'm going to go ahead and palpate. First I'm going to do a light palpation, which is only going to be 1 centimeter deep, and then I'm going to go ahead and do a deep palpation, okay? So I'm going to start off with the light palpation, which is only about 1 centimeter deep, to feel any masses or any abnormalities. And I don't feel any masses or abnormalities in your stomach. Now I'm going to go ahead and do a deep palpation, which is going to be about 5 to 8 centimeters deep. So just try to relax, okay? And let me know if you're having any pain. Are you having any pain?
No.
Okay. I don't feel any masses or anything, so that's normal. Do you have any questions?
No.
Okay, so let's go ahead and sit you up, and then we'll be done with this examination, okay?
Okay.